Hi, it's Dr. Lisa with another CBT tip, and I want to talk to you today about perfectionism. If you are a perfectionist, you know it's a double-edged sword. Having really high standards can help you to optimize your performance at work and in other areas of your life. But it can also lead to chronic dissatisfaction with the things you actually achieve and fuel a sense that somehow you're just never good enough. It can also be a contributing factor to writer's block and procrastination. So in your attempt to write the perfect essay, you sit for hours in front of a blank computer screen, having written absolutely nothing. Or you say to yourself, if I can't do it perfectly, I won't do it at all. And months go by and nothing gets done. On a more serious note, perfectionism is a major contributing factor to a variety of clinical disorders, including body dysmorphic disorder. In this disorder, people suffer intensely in response to perceived defects in their appearance that you or I might not even notice, even becoming suicidal. It's also a contributing factor to eating disorders, to obsessive compulsive disorders, and depression. So the big problem with perfection is it's often a moving target. We tell ourselves we'll know it when we see it or when we've reached it. But if you stop and think about it, besides a multiple choice test in school, perfection is really subjective. It's in the eye of the beholder. For example, what's a perfect law school admissions essay? Who decides? What criteria would we use? Certainly for one, no spelling errors. I suppose no grammatical errors. Clarity, but above and beyond that, whoever's reading it may have different criteria in mind than the writer. In cognitive behavioral therapy, you'll learn how to define, or what we say, operationalize perfectionism. And what that really means is how to translate it into specific criteria so you'll know it when you hit it. So before I write my essay, I decide what a perfect essay is, I meet those criteria, and I'm done, rather than sitting with it for hours, feeling dissatisfied or revising. So we clarify it up front. You'll also learn how to channel your perfectionism more selectively, saving it for certain things and not using it for others. So primary focus in CBT with perfectionism is targeting black and white thinking. Many perfectionists have a black and white thinking style, and what that means is they think of themselves and their performance and sometimes other people in terms of mutually exclusive categories. So either I've succeeded or I've failed. The problem with that is there's no middle ground. There's no room for I did pretty well. I could do better next time. So this kind of thinking style can lead someone to think they're a failure even though their performance was way above average. For example, a student who gets an A- or a B+, who has a black and white thinking style, may conclude she failed and may even become severely depressed and certainly not motivated to improve performance. So taking basketball, for example, you can't hit every three-point shot, but you could still be exemplary. So the problem with that is if the player has a black and white thinking style, he's going to think he's a failure. But we know in the league, if you're shooting above 40%, it's exemplary, right? Which is far below 100. So by helping perfectionists to adopt a more shades of gray, more nuanced kind of thinking style, it helps them to chip away at dissatisfaction with their own performance and enables them to more realistically evaluate their performance and also what's entailed in getting something done. All of these techniques used together over a period of time can help the perfectionist chip away at the belief they're never good enough, increase self-satisfaction, and use perfection only to their advantage. For more CBT tips like this, check out my website and my Instagram.